All right, thanks for having me.
Yeah, thanks. For the show, I pointed out I had a burn, and he said, "Oh, that's nothing. Look at this."
Yeah, well, I got a small burn.
What do you guys burn?
I got the air fryer.
Ah, the air
Yeah,
fryer.
Yeah.
Mine was the oven. I was taking a thing out of the oven.
Really? You should use oven mitts, both of you.
Yeah, I just got yesterday I got one of those Blackstones, so I had that seasoned up. That's going to be a...
That's nice. Send us some pictures once you start cooking on that thing.
Yeah.
Did you get to see...
I was in on Sunday.
Was Jake there?
Jake was not there.
No.
I asked for Jake, and they said, "No."
He's not here. He's not here. He said, "Hey, he's my primary physician."
Yeah, I wasn't working either. You could have came in if you would have called.
So I had the flu, and it's over. But measles, it's like, did you ever think we'd have measles like we are seeing it now, particularly in some states?
Well, it's crazy because, like, in medical school, you learn about measles, and it was a disease. I believe in 2000 we declared it eradicated. Obviously, it was still going, it's still prevalent around the world and everything like that. And there's always cases in the United States from whenever unvaccinated people would go, to other countries or whatever, and they bring it back. But normally just dissipate out because there's enough vaccinated people. But now, so I've had to go back and kind of learn a little bit about it because I was like, I remember in med school, but then you never see it.
You didn't think you'd see it.
Never think you'd see it. It's kind of like how chickenpox is.
Right.
It's like I haven't seen a case in chickenpox since I had chickenpox, but you don't see chickenpox going. It's the same thing with measles. So I've had to go back and kind of do a little bit of research just because I kind of forgot how to treat it and what the symptoms are. And
It's pretty much 100% people who are not vaccinated.
Yep, pretty close. So especially if you've gotten your vaccines after, I believe the cutoff was kind of 1960, 1964. That's when they kind of changed it for, you're pretty much, it's 97 to 99 if you've had the two vaccines, the vaccines that effective.
When do you get them? Is that something that you get at a young age?
It's in the MMR vaccine, so they pair it with the mumps and rubella vaccine, and all, 3 in combination. It's I believe you get two of them. So very effective, and it should confer lifelong immunity. If you got the vaccine from when it first came out to about 1964, it's recommended you get a titer to see if you still have protection against it. Just because the vaccine was less effective at that time, a lot of times they would recommend a booster. So
well, we should be good.
I'm good.
Are you seeing the older population? Is that?
I think the one one of the cases in Michigan was a more elderly patient.
Okay.
So I don't know about their immune status. I believe it was in Rochester, Michigan.
You don't want it. I know that.
Well, I don't want it. I don't want chickenpox. I remember having chickenpox as a kid. And I think I only had it once. Can you only get chickenpox once, or can you get that more than once?
So the virus will stay in your body throughout your life, and that's what causes shingles. Is when that kind of when that virus reactivates. But you should only have the kind of chickenpox effect once. But yeah, I remember when I was a kid, and we used to have chickenpox parties and everything like that. But at the time, that was the only option. Like you were gonna get chickenpox, so parents would kind of coordinate. Like, I want all my kids to get chickenpox at the same time and just get it over with. Now, obviously, we don't need to do that because of the vaccine. And even chickenpox by itself, we all had chickenpox. My sister almost needed surgery for chickenpox. Actually, she had developed a skin abscess, just like with our burns. Whenever there's a break in skin, it opens yourself up to a skin infection. So she got an abscess, and as we were living in Madison, Wisconsin at the time, and she was in the hospital for a couple of days with IV antibiotics, and we're going to go to the operating room to drain it. And when she was in the elevator going up top of the room, it burst.
Unbelievable.
So she had a new surgery.
Wow,
came home that day.
Amazing.
Yep. So,
I have to imagine there's a lot of people that come in with untreated wounds that are infected. Is that one of the biggest reasons that people are finally entering the ER?
It can be for sure. And people,
I mean, that's a bad example. Like a serious cut or something.
I
put that stuff on it in the yellow tube.
Neosporin?
Yeah.
You should be fine.
That's good. Yeah. One of the mistakes I do see, we brought this up, is people use hydrogen peroxide like multiple times. Like, it's like using hydrogen peroxide five times a day for 5 days. It's like, that wound's never going to heal. Hydrogen peroxide's killing all the, or you're getting rid of all the healing tissue and everything like that. So one time's probably okay. I think soap and water is probably
good
just
advice.
as effective without
Right.
causing any destruction. And just one time clean it out, good Neosporin over it, cover it for a
Okay.
day or two till it kind of covers up. And the main thing is just cleaning it initially.
Hydrogen peroxide is one of those things that should last a lifetime when you buy it. Don't you
Yeah.
think? Like a jar or a bottle of it.
Bottle of it.
You have a bottle of it.
I have a bottle of it.
Yeah, you gotta keep
Yeah.
keep it in the dark.
I have one on my
dark.
desk.
Of hydrogen peroxide?
It's just
Maybe that's why you're
Well,
always
it's
in
like-
IEP so much.
put it in your ear, clean out your ears. There's a lot of uses for
I can do a lot of things with that.
I guess so.
Yeah, we've had to use some for our poor puppy. She
Really?
she likes socks.
See,
So that's
you
what they
gotta-
recommend. Swallow some.
You can
hydrogen
drink it.
peroxide.
So you got to be careful with that. Oh my
Yeah, it's
God.
not good. Yeah.
Drink
I know.
hydrogen
You
peroxide?
can drink it.
Well, it makes you vomit. Yeah.
Really?
That's what we had to do
man.
to get the
I'm
sock
gonna
out.
stop drinking it. No, you can rinse your mouth with it, right?
I wouldn't.
I don't
Yeah, I don't know. Unless Dr. Jake tells me to do it, I'm not doing it.
Yeah,
I'm
I was
not
gonna
interested
say
in
I've
that.
made it this long without
Yeah.
swishing hydrogen peroxide.
Oh, that's why it's still full on my desk.
Okay.
I hardly use it.
Yeah, I wouldn't recommend swishing with hydrogen peroxide.
That was never one of the recommendations against COVID. I
I bet
don't
not.
think.
I
Out
bet
of all
not.
the different things that were proposed, I do
Yeah.
not think hydrogen peroxide was one of the.
Well, Clorox makes hydrogen peroxide wipes. Or
There's
Lysol
probably
or something.
a touch of it in there. I don't think
Yeah.
it's.
So 5 years.
It's crazy to think it's been that long. Me and my wife were talking about last night when she asked what I was going to talk about this
Yeah.
morning, and yeah, it's been a long time. I remember driving into work in my car, only the car on the road.
Yeah,
Yeah.
It's crazy.
amazing.
And my wife too. She was pregnant, kept working
Right.
through. So.
Crazy times for everyone dealt with something different, didn't they?
Oh yeah. And I don't think I ever got COVID.
No.
Same. Yeah.
Yeah, I never tested
haven't had it?
positive.
No, Dr. Sinkoff and I, we were talking about that at the dinner the other night. Him and I,
Yeah, I was gonna say it. Never.
unscathed. as
Yeah,
far
it's
as
like
Oh.
I think the way like for those 2 years when we were wearing masks often,
Yeah.
never got even a cold.
I didn't get it until like last year.
That's not true. You've had it like 30 times.
No, once, maybe twice.
Okay.
Thanks for all of the help you've provided us over these last 5 years during COVID, and thanks for being here today.
Yeah, thanks for having
Thank
me
you.
again.
From Henry Ford and IEP, Dr. Jacob Sinkoff. The morning show continues after this.